According to the World Health Organization, 1.28 billion adults aged 30 to 79 years have hypertension worldwide. Most two-thirds of this population are living in low and middle-income countries like Nigeria. 4 to 6% out of this estimated population with hypertension are unaware that they have this condition. Less than 42% of this population with hypertension are diagnosed and treated. Hypertension, if not controlled, could lead to severe damage to the heart, kidney, and brain. This leads us to the question for today. What is hypertension? What causes hypertension? What are the risk factors for hypertension? And how can it be managed? Hey, welcome to Mind, Soul and Body. My name is Obiamaka. So I have uploaded a video about the introduction of this channel and the videos that we're going to be expecting, the contents that I'm going to be uploading on this channel. So I advise that please you head over and watch my introduction. So without further ado, I want us to quickly dive into our topic for today, hypertension. So in this video, we're going to be discussing about hypertension. We're going to know what a blood pressure is. We're going to know the classification of blood pressure. We're going to know about the diagnosis of hypertension. We're going to know about the causes of hypertension, the risk factors for hypertension, and the management of hypertension. So what is blood pressure? Blood pressure is the pressure exerted by the circulating blood against the walls of the arteries, which are the major blood vessels in the body. So in hypertension, the pressure is too high and it exceeds the normal value. So the normal value of blood pressure in an adult is less than 120 over 80 millimeter mercury. So in blood pressure, we have two values. The first value is the higher value and it stands for the systolic blood pressure. So the systolic blood pressure is the pressure in the blood vessel when the heart contracts. Like I stated earlier, your systolic blood pressure, the normal systolic blood pressure, it's supposed to be less than 120 millimeter mercury. So the second value, which represents the diastolic blood pressure, it is the lower value. So the diastolic blood pressure is the pressure in the blood vessel when the heart relaxes in between beats. So your diastolic blood pressure, the normal value for the diastolic blood pressure is less than 80 millimeter mercury. Classification of blood pressure. First, the normal with systolic less than 120 millimeter mercury and diastolic less than 80 millimeter mercury. Second, we have elevated blood pressure with systolic between 120 and 129 millimeter mercury and diastolic less than 80 millimeter mercury. So it's important that we understand that elevated blood pressure is not yet hypertension. So third, we have stage 1 hypertension. So in stage 1 hypertension, the systolic blood pressure is between 130 and 139 millimeter mercury, and then the diastolic is between 80 to 89 millimeter mercury. So in stage 2 hypertension, systolic blood pressure is at least 140 millimeter mercury, or the diastolic is at least 90 millimeter mercury. So fifth, we have hypertensive crisis. This is where we have systolic blood pressure over 180 and the diastolic blood pressure over 120 millimeter mercury. So if you check your blood pressure at home and you discover that you're getting 180 over 120, please, this is a medical emergency. Head to the nearest hospital for immediate medical attention. Diagnosis of hypertension. So the diagnosis of whether or not you have hypertension is only left for the doctor to ascertain, as a doctor will go ahead to measure your blood pressure, get a concise medical history from you, physically examine you, and also order some blood investigations and some tests like the ECG, electrocardiogram. So these investigations and tests will help the doctor to find out the possible cause of your hypertension and also to detect if there's a presence of an end organ damage. So we have primary hypertension and secondary hypertension. In primary hypertension, there's an abnormally high blood pressure, which is not as a result of any medical condition. So primary hypertension can occur due to environmental factors, genetic factors, that is, if you have a family history of hypertension. It can also occur as a result of obesity or unhealthy lifestyle and diet. So primary hypertension accounts for 90 to 95% of the adult cases of hypertension. While secondary hypertension, in secondary hypertension, you have an abnormally high blood pressure, which could be from multiple conditions that can be of renal or vascular or endocrine causes. Risk factors for hypertension. So the risk factors for hypertension has been grouped into the modifiable risk factors and the non-modifiable risk factors. So for the modifiable risk factors, we have cigarette smoking, we have high dietary intake of salt, unhealthy diet, we have obesity, we have physical inactivity and stress. So these factors are called the modifiable risk factors because when you make some lifestyle changes, you could reduce your chances of developing high blood pressure or hypertension. So we have the non-modifiable risk factors. First, a family history of hypertension, you can't change it. And then age. The more you age, the more you get old, the higher your chances of developing high blood pressure. So male sex, hypertension occurs more in males than in females. Although after the age of 60 years, the prevalence of hypertension in female increases more than in male. So lastly will be the presence of some disease conditions like chronic kidney disease and obstructive sleep apnea (OSC). Management of hypertension. So if you've been told by a doctor that you are hypertensive, the first line of treatment of hypertension is by taking your antihypertensives as prescribed by your doctor. So first line of management is drugs, your antihypertensive. So secondly is weight reduction. Studies have shown that for each 10 kilogram of weight you lose, there is a 5 to 20 millimeter mercury reduction in your systolic blood pressure. So it is advised that you engage in physical activity for at least 30 to 1 hour daily. Third is reduction in the dietary intake of sodium. So sodium is found in salt and monosodium glutamate, which is used in the production of the condiments that we use for cooking. So the World Health Organization have recommended that for hypertensives, they take not more than 5 grams of salt daily. So for this recommended value of not more than 5 grams of salt daily, you get to have 2 to 8 millimeter mercury reduction in your systolic blood pressure. So one question that you might ask is, how do I even know the quantity that is 5 grams of salt? So 5 grams of salt is almost equal to a teaspoon of salt. Almost equal to a teaspoon of salt. So you are limited to only 5 grams of salt daily. And then you know what we have: our breakfast, your lunch, your dinner. So how can it be achievable? First, you can get your 5 grams of salt, put it in a small bowl, and then use it sparingly to cook your dinner, your lunch, and your breakfast. So another option will be to dissolve your 5 grams of salt in small quantity of water, and then you can use it and cook whenever you so desire to cook. But this will help you to achieve the daily target of not more than 5 grams of salt a day. Fourth is the increase in consumption of potassium. So potassium ion increase in potassium ion actually helps in the excretion of sodium out of the body, because sodium is responsible for elevation of blood pressure. So when you have increase in potassium is going to help in the excretion of sodium out of the body, eventually leading to a reduction in the blood pressure. There are several fruits and vegetables that are rich in potassium, including bananas, cucumbers, pears, avocados, milk, chicken, beef, and lots more. So fifth is to limit the intake of alcohol. It is recommended that men take not more than 2 drinks per day, and then women take not more than 1 drink per day. But the question will be, what serves as a drink? So according to the picture you're going to be seeing displayed on the screen, it's going to help us better understand what will pass as a drink. So for the normal regular beer we drink, which contains about 7% of alcohol, 1 drink is 12 ounces of your lager beer, which is equivalent to 1 can of beer. Yes, so 1 drink is 1 can of beer. So for your beer men, it is recommended that you take not more than 2 cans of beer per day, and women take not more than 1 can of beer a day. Wine contains 12% of alcohol. So a drink for wine should be 5 ounces of your wine. So for men, you're expected to take 1 full glass of wine a day, not more than 1 full glass of wine a day. And for women, you're expected to take not more than half a glass of wine a day. So for our distilled spirits, your vodkas, your gins, your tequilas, which contains 40% of alcohol, you are expected to take 1.5 ounces of your distilled spirit, which could pass for 1 shot. So for men, do not take more than 2 shots of your spirits a day, and then for women, do not take more than 1 shot of spirit a day. So lastly will be to quit smoking. Thank you so much for sticking with me to the end of this video. So I have 2 questions for you. When was the last time you checked your blood pressure, and what was the value you got after checking your blood pressure? Please, I need to see these answers in the comment section. And don't forget to give this video a like. Please subscribe to my YouTube channel so that way you can get easily notified anytime I upload a new video. Please, I have to beg, please share this video with your family, your friends, your loved ones. I will really appreciate it. Until next time, stay healthy, mind, soul, and body.